I want to talk about today why Lyme is never just Lyme, because oftentimes people come to me and they're like, well, I've been diagnosed with Lyme and I don't really know what that means, or I've been on treatment for 10 years and I'm not better, or 5 months and I'm not better. And so part of this series is to educate people on why, what, how this is so complicated. The first thing I want to tell anybody struggling with Lyme or has a loved one with Lyme that's had a diagnosis of Lyme is that Lyme is harder to treat than cancer. You'll hear me say this over and over and over, and I treat patients with cancer. It is a devastating illness, so I do not want to just shoo that away. But with cancer, the immune system is doing something or not doing something that needs to be taken care of. It's way more complex than that. But with Lyme, it's never just Lyme. That's why it's so complicated. So I tell my patients, because I'm not the only Lyme doctor. I'm not the only doctor treating chronic disease, and I want every other practitioner out there treating this disease to be 100% successful because their patients need them too. The first thing to understand about this is that Lyme particularly is Borrelia burgdorferi. It is shaped like a spirochete, so that means that, well, it is a spirochete, which means it's shaped like a corkscrew, and it can go into an L form and it can hide in a cyst. So that's why it's hard, because the bug is so complex. And I just want to talk about Borrelia a little bit, and then I want to talk about why it's a problem, and then I'm also going to talk about the co-infections and all of that. So because Borrelia is shaped like a corkscrew, it burrows its way into tissue. So it loves the optic nerve. Lots of Lyme patients, vision come in and out. They have really bad floaters. They'll be reading a book and they're like, what is wrong with my vision? Their vision will change. They'll have visual migraines. They'll be really photophobic, meaning that they have problems with the lighting. So Lyme, Borrelia particularly, also really likes to burrow itself in connective tissue. Lyme is a connective tissue disease, which most of the body is made out of connective tissue, so that makes sense. Lots of people either get like a neurological Lyme where they're having MS type symptoms, migraines, headaches, vertigo, hearing problems, or there can be like more of a gut Lyme, so IBS, diarrhea, constipation, heartburn, those kinds of things. And with that said, there is a huge myriad in between there of what it can manifest, and sometimes people have both. So back to the spirochete. The thing about staph or strep is that typically staph or strep, I'm comparing staph and strep to Lyme, so we understand why it's so complex. Staph and strep typically is shaped like a grape or shaped like a rod, and typically there's only 3 cell proteins on those microorganisms. There might be more, there might be less, depending on its mutation. So when you take an antibiotic, the other thing about staph and strep real quick is it's multiplying all the time. It's growing like crazy. That's why it becomes so scary. If you get strep throat or you get a staph infection, you have to get on antibiotics. And so what happens is that bug is it's growing really fast, it's replicating really fast. So you give an antibiotic and it hops on one of those cell proteins so that it no longer can replicate. This is a big deal because then the antibiotic after 7 to 8 days, 7 to 10 days, 7 to 14 days, you're better and your infection's gone. Lyme, on the other hand, is such a large microorganism, it has over 120 cell proteins. So here we are with staph and strep with 3, and here we are with a spirochete that has over 120. So that means if you're put on antibiotics for Lyme disease, in the next rotation, which again, staph and strep is replicating really quick, Lyme replicates very slow. It replicates usually once a month. And there's some theories out there, it replicates with the moon. If you see patients with Lyme, you know that around the full moon, their symptoms are going to get worse. I cannot explain that science. I can only tell you anecdotally, as a clinician, it happens every month. So now that bug is only rotating every month, and it goes, oh, I'm being hit by an antibiotic. So I am going to re-replicate myself, and I have 120 cell proteins that I can become something totally different. So now if you're taking 400 milligrams of doxycycline a day, that doxycycline no longer works. So docs that are treating Lyme with antibiotics, they should, and the best ones are, rotating a series of antibiotics every 6 weeks, and they're usually using multiple antibiotics. That is the theory behind that. That's why this is so complicated to treat. Now, the other thing that's important to know is that it only takes 1,000 spirochetes to make somebody have Lyme symptoms. It takes millions of organisms of staph and strep to make you have an infection. So now you have what I call a stealth infection. It's slowly hiding in the body. You know, first you're like, oh, I'm a little bit achy, and now all of a sudden my joints are all crickety, and now when I wake up my hands are stiff, and now I'm having migraines, and now my shoulder is bad. And now 10 years down the road, I can't get out of bed, I'm depressed, I have anxiety, nobody loves me because I don't feel well and I don't want to get out and I can't maintain relationships. Staph and strep, on the other hand, you're just sick. You take antibiotics and you get better. So I love that we have that solution for staph and strep and those acute infections. Lyme is not acute infection. It is a stealth infection. Now, with that said, if you come and see me and you have a tick that is embedded in your leg, you better believe I'm going to flood you with antibiotics so heavily to make sure that your Lyme does not become chronic Lyme. And so that's just a little bit of a difference. The other reason that Lyme is really complicated is because Lyme is never just Lyme. It usually has co-infections. Now, there is a slew of pronunciation of these bugs, so I'm just going to tell you how I pronounce them. There's Borrelia burgdorferi, and now we're finding multiple species of Borrelia. There is Babesia, Bartonella, Mycoplasma, some forms of chlamydia, and now with the research, we're finding that most people that have Lyme plus co-infections also have a problem with mold, heavy metals, Epstein-Barr virus, cytomegalovirus, herpes virus. And so really, if you start to think about it, what Lyme is doing in your body is it's hollowing out your immune system. So now all of a sudden you're like, oh, I don't really want to go skiing anymore. I don't really want to cook my food anymore. I don't really want to talk to you anymore. I'm not really interested in being intimate with you anymore. I don't want to read anymore. And slowly this disease starts to hollow you out. So you're no longer in there. And so it changes people, but it's slow and torturous. In Chinese medicine, this illness is actually called Gu syndrome. And Gu syndrome, if you look at the Chinese symbol of it, it actually is very similar to the symbol of torture. And that's what is happening. These illnesses torture patients slowly and surely. So often my patients will come into me and they'll be like, hey, Dr. D, I've been in treatment for 15 years. I've seen 20 doctors. I'm tired. I'm going to go home. I'm going to stop taking my medications and my supplements. I'm just going to die. And I tell them, I wish that was the case, but this disease doesn't kill you. It just tortures you. So you have to stay in treatment. Now we're going to talk about treating Lyme disease. People call me and they say, hey, Dr. D, what are you doing for Lyme disease? And I tell them, not one of my patients is on the same treatment. Not one. I do not have protocols, because a 48-year-old woman, postmenopausal with Lyme, and an 18-year-old female that still has function with Lyme, everybody's different. I mean, it can be the same 48-year-old woman and another 48-year-old woman, and they're not going to be on the same thing because everybody is different. So I do not do protocols for Lyme. I do Lyme specific because everybody's different and this disease manifests in everybody that's a little bit different. Lyme is never, let's kill the bug. Let's kill it. Let's get rid of your infection. It's always a detox process, because lots of patients that have these stealth infections, whether it's Epstein-Barr virus, whether it's mold, whether it's Lyme, Borrelia, Babesia, they lots of times have what's called an MTFHR, which stands for methyl tetrafluorohydrate. There's a lot of research on this, meaning that they can't get better. So you're kind of chasing their tail. Their liver is starting to get congested, and so it can't get cleaned out. So oftentimes I tell my patients, your liver is a lot like a sponge, and you have to think about what happens when you put a sponge in a sink for 7 weeks and you don't wring it out. So when people first start to come and see me, I tell them, I gotta wring out all your organs. We have to clean up some of this mess, because you are born with your God-given ability for your body to heal itself. Every mechanism you were born with for your body to be able to heal itself, unless of course you were born with something genetic or a dysfunction. But the truth is that my job is not to heal you. My job is to show your body it's the healer and get every other thing out of the way that's making it so you can't heal. Whether that's your diet, whether that's your water, whether that's your emotional state, whether that's the words you're saying in your head that are telling your body where you are in space and time. And sometimes those words aren't very nice, and your brain is literally the mama, and the cells are just waiting to be told what to do. And so lots of times my job is to figure out where the massive dysfunction is and to start removing those things so that people can get better. And oftentimes, because people have been sick with this disease for so long, they're burnt out. And I tell my patients, I see that you're in treatment fatigue. Let me help you decide what you can do. I see here you're coming in to see me. You have 40 supplements, 15 pharmaceuticals. How are you doing taking all this every day? And most of the time they're like, I'm exhausted. I'm not any better. I have no support. And I just say, let's stop the madness. Let's tailor this so specifically to you that you slowly start to get better. Because in my mind, if you're taking 42 supplements and 15 pharmaceuticals and you're not getting better, it's not working. And it brings me back to the idea of Lyme, that if you have Lyme, you're going to be more sick treating it than not, which is usually called a Herxheiming reaction, which means that you're having a die-off reaction. And the truth is that I don't believe in that a ton, because you only have so many exits out of the body. You only have so many pathways you can detox. So if you flood that detox pathway and you go into Herxheimer reaction, meaning now you're having a migraine, your muscle aches are getting a lot worse, all of that, in my mind, the body's saying, please hold for a minute. And we do, we adjust and we move and we ebb and flow. And back to what I said about Lyme and it having so many cell proteins, you have to rotate your treatment at least every 3 months. So if you have a doctor that's put you on Cemento or Banderol or Monolaurin or cat's claw or even antibiotics, you have to rotate that at least every 8 months or 3 months. I usually like to rotate my patients every 6 to 8 weeks because that bug is so smart that it goes, uh-oh, this herb is killing me. Now I'm going to mutate. I'm going to become something different. And if you don't catch it, you're going to do this. I tell my patients most of the time when I find them, they're standing at the cliff and they want to jump. And I just hold their hand and I say, I'm going to hold your hand and I'm going to make sure you don't jump. And eventually we're going to start taking some steps back from this cliff. And then we're going to get on a roller coaster and it goes like this. And then eventually you're going to be high on the mountaintop and you're not even going to remember that cliff you were at. But if I don't explain to my patients about this, then they stop coming back to me because they're like, well, I'm not getting better. But there's so many things we can do to make sure you're getting better. Thank you so much for watching our video. Please subscribe below so YouTube knows that you like this content. Ring the bell. Much more to come. And please leave a comment if you have any additional questions or comments. Thanks a lot.